So I will not take much time. It's your time to chill out, but it will be mostly I will just give the answers, not to explain anything. अभी explain करने का time नहीं है, ठीक है? अभी ये मस्ती करने का दिन है आज. थोड़े ना दिमाग ही खराब करते रहोगे, क्या ठीक हुआ क्या गलत हुआ. It's a time to enjoy, but just have the answers. Previous hurt. Yes, severe pain for 15 days. Pain should be for minimum 15 days, not 5 days. So this is simple. A is the answer. Clear? Second is, this is also very simple, that before 20 weeks, one doctor, 20 to 24 weeks, we need two doctors. ठीक है? And after 24 weeks, we need a medical board. Medical board. So here the answer will be 20 to 24 weeks. Is clear? Questions were like this only. Jai Gurudev. Questions are correct. I think these would have already been discussed. MTP wala. So these are all previous year topics, previous year questions. What's the minimum age for MTP? This is a wrong question. Wrong question. There is no minimum age defined as such. But what is defined in MTP Act is that below 12 years, a legal guardian consent is required. So by default, here the answer will become 18 years. As such, the question was wrong. Maybe the examiner who drafted this question was in a lapad jhandu state of mind. But here, this will be our best bet. Okay? The best bet will be 18 years. People are studying so much and then you give wrong question. The examiner should understand this. The person who is drafting the paper. आधा दिमाग लगा के क्वेश्चन बना देते हैं. Now, triad of bruise, abrasion, and laceration. These three are the features of, these are Marshall's triad. Marshall's triad, which is seen in secondary bomb blast injury. Secondary bomb blast injury. So the answer here will be bomb blast injury. That's also very simple. Okay. This was asked in the INI-CET November 2025 also. So previous year questions are so very important, as all of the cerebellum faculties emphasizes again and again. There must be some leopard jandu student who would have not gone through the previous year question. Tell me how many of you did it wrong. You did it wrong, that means you didn't do the previous year question. So aluminum phosphide reacts with AgNO3 to give silver phosphide, which is black in color. Okay, so the answer here will be aluminum phosphide. Okay, this was the question. Am I right or wrong? Question was this only, no? Because these are recall. Just let me know. Barbiturate was also option. ठीक है, so let's make it barbiturate. But answer remain aluminum phosphide only. ठीक है? Malathion was also there. ठीक है? Answer will remain aluminum phosphide. ठीक है? Which of the following has poison to their corresponding effect? This is such a simple thing. Organic irritant, it will be croton. So A is 2 croton. Metallic irritant, lapad jandu, chappu question. B 4 lead. Deliriant, we know cocaine, datura, cannabis. These three are deliriants. Okay, these three are deliriants. Depressants, we all know, opioid. So this was a very pappu question. Okay, so A 2, B 4, C 3, D 1. क्वेश्चन ठीक है कि नहीं है? एटलीस्ट लेट मी नो. पता चले आर यू गाइस लिसनिंग टू मी? एम आई ऑडिबल और नॉट? यस तो बोलो जय गुरुदेव अगर सुनाई दे रहा है तो. शिकारी भेड़िया मतलब सुन रहा है. ठीक है. Calculate the percent. This would have been covered in the surgery. Now the problem with these kind of questions is we don't, if there is an issue in the recall, the answer changes. Okay, so I would have this would have been covered in surgery, but I will just cover. I don't know whether it's covered or not. But anterior aspect of chest, that becomes 9%. Both upper limbs, that becomes 18%. Front of face and eyelashes. Now, face and neck, actually, face is 7, neck is 2%. So here we can consider it as 7%. Okay, so this becomes 7 plus 9, 16, 16 plus 18, it becomes 34%, something like this. Okay, it becomes something like 34%. Clear? But it all depends that exactly what was asking the question. Both upper limbs were there or front of upper limbs were there. It will all depend upon that, whether it was both upper limbs or front of upper limbs. Tell me. See, the answer will, unless and until I know the exact question, I don't know whether the answer is 30% or no. It will all depend that how exactly was the question. Okay. Both upper limbs were there. So both upper limbs will definitely be 18%. Anterior aspect of chest was there. Anterior aspect of chest was there or not? So anterior aspect of chest, that will be 9%. Okay. That will be 9%. And then face, whether eyebrows is of course a part of face only. No. So this you can consider it as minimum 7%. So this become 18 plus 9, 27, 27 plus 7, 34%. So I will mark A as the answer. Okay. Eyelashes is a part of face only. No, face में आ गया 7%. That's okay. Wrong statement with respect to snake bite. Viper bite is vasculotoxic. Yes, that is of course true. Cobra bite is myotoxic. Pappu question we all know. Cobra bite is neurotoxic. Myotoxic is sea snake. Sea snake. Myotoxic is sea snake. Clear? So only front of face. Oh, sorry, only front of face was there. Wait, sorry. Then it becomes 9 plus 18 plus 3.5%. I'm sorry. Then it becomes 3.5%. Only front of face was there. Then it becomes this. So 18 plus 9, 27. Okay. So 27 plus 3, the answer becomes C. In that case, the answer becomes C. Only front of face was there, no? So then it becomes 3.5%. The answer becomes 27 to 33%. Okay. Okay. It will become 27 to 30%. See, cobra is same as elapidae. Elapidae has cobra and crate. Cobra is elapidae. So basic thing that you should be knowing is elapidae, cobra and crate, these are neurotoxic. Even if the choices were either, whether the question was, so this will be the answer, whether cobra bite is myotoxic or elapidae is myotoxic. Okay, if the choice was elapidae is myotoxic, then this will be the answer. This will be the answer. Okay. This option, this will be, because this is, we all know elapidae is neurotoxic, not myotoxic. And most snake venom contains hyaluronidase. All was there at most. See, most is actually not very correct, but hyaluronidase is present in most of the poisonous snake bites. So we have to choose the best possible. Elapidae is myotoxic is definitely wrong. Elapidae is myotoxic is definitely wrong. Okay. Now, a lady comes with her doctor to hospital with alleged history of rape of her daughter. Mother says daughter's age is less than 18 years. So basically, you have to determine whether which X-ray will be the best for 18 years. So for 18 years, always remember the most important X-ray is wrist. Most important X-ray is wrist. Lower end of ulna and radius, they fuse near this. But here, wrist was there. So lower end of radius and ulna, they fuse somewhere between 17 to 19 years. Middle end of clavicle, 21 years. 18 years it appears and fuses at 21 years. sternum the body of sternum fuses between 14 to 25 years. Middle end of clavicle appears at 18 years and fuses at 21 years. Elbow and shoulder was in option. अच्छा मुझे option फिर tell me the option again. I will look at the option again. Elbow and shoulder or wrist and shoulder? Elbow and shoulder. So elbow and shoulder was there. Other choices are correct. Other choices are correct. Wrist, hip, and medial end of clavicle. Wrist, hip, and medial end of clavicle. What else? देखो, even if you don't remember the exact option, the choice will be wherever the wrist was present. Simple thing. Because wrist is the best for 18 to 19 years. Around 18 years, the most important X-ray. And I think all of you are saying that wrist and medial end of clavicle were written together. This is true or not? Wrist and medial end of clavicle was written together or not? So then medial end of clavicle was written. Medial end of clavicle appears at 18 years and fuses at 21 years. ठीक है? So different people are showing different things. Very simple. Wherever wrist was given, you consider that as the right answer. Okay? Wherever wrist was given. Which Indian law protects medical data security? If you know this, then you are a leopardus. If you knew this question, at least no forensic teacher would have taught this. अच्छा अभी there is a lag, पीछे चल रहा है शायद. Elbow fuses near 16 to 17 years. So this question was a Leopard Jandu's question. It was should not have been asked. I think only short forms were written, but I will tell you, I never teach this. No forensic faculty will teach this. But since it was sometimes 1 or 2 questions are going to come like this, so don't worry about this. देखो, don't worry. अगर कोई एक आधे question में it was people are giving me different choice. So DPDP is the answer. Digital Personal Data Protection Act. So this act is basically for protecting confidentiality in India. So it is not only for actually medical data, for any data in India. For example, like your Aadhaar card, PAN card, your age. So main thing is now as the internet world is coming, virtual world, the main thing is your data cannot be used without your permission. And that applies to medical data also and any other data. So for India, we have DPDP Act. It came recently in 2023, and GDPR is the similar act which came in, which is for Europe. That was the first act which came in Europe. And following the GDPR Act, the DPDP Act came in India. PNDT, we all know it cannot be the answer. HIPAA is for USA. HIPAA is for USA. So for India, the answer will be DPDP. ठीक है? Okay, which dental notation is represented in the below layout? There's some lag, so maybe I should go a bit slow. Okay, so which dental notation is represented? So please remember, whenever it is 1, 2, 3, 4, 5, 6, 7, 8, always. So this is Palmer's. This is Palmer's. This is Palmer's. And palm and hand. So you can remember like this. Palm and hand. Both are same thing, palm and hand. So header up is similar to Palmer. So suppose you put one plus sign like this. If you put a plus sign, if you put a plus sign like this, sorry, then it becomes Palmer. Sorry, header up. If you put a plus sign, it becomes header up. Universal is simply we go like this from here to here. This is universal. The first one is Palmer. I think this is asking the question. The below one is header up. And the last, where we put give every quadrant we give number 1, 2, 3, 4. These numbers we give 5, 6, 7, 8. This is FDI. So here the answer will be Palmer. Palmer. A child has, ठीक है, there was, I think 1 or 2 questions were bit googly questions, but I can say that 90, most of the 90% were from notes only, 90 to 95%, rather 95% I will say. So this question was simple question. अब एक दो क्वेश्चन तो ऐसे पूछे DPDP Act. You can't even imagine that somebody can ask about DPDP Act. Okay, now so this was a simple question which something on chronic mercury poisoning was asked. I think the choice was some Mad Hatter feature was there. Somebody was saying some Mad Hatter was written. Mad Hatter was written. So which finding will be found? Something related to Mad Hatter will be found. Something related to Mad Hatter or Denbury tremor. That will be the answer. So this was the question. Am I correct or not? Tell me. Mad Hatter was there. Okay, so that will be the answer. Wherever you saw the Mad Hatter is for mercury poisoning. Simple. Okay. Mad Hatter, Denbury tremor, whatever it was, that will be the answer. So which is in, so I think this is more, this was covered in psychiatry. I will not go through it. This was covered in psychiatry. Cannabis, inhalational, I don't know. This was covered in psychiatry. So that's it. So I hope most of you did your exam well. And the notes and the classes helped. I believe so. Most questions were from these, except for एक DPDP और ये एक दो क्वेश्चन कुछ ऐसा आया होगा. Thank you so much. Thank you so much.